Good morning, dear students. I am Adarsh Kumar, lecturer, Faculty of Nursing, Rama University. Today I am going to deal with the topic appendicitis. This is the topic from the taken in medical surgical nursing, and we will discuss in here regarding definition of appendicitis, causes of appendicitis, pathophysiology of appendicitis, symptoms of appendicitis, and diagnosis and management. What are the management we can take in this condition? So first we will discuss regarding the definition of appendicitis. Appendicitis, it means appendix. In here, inflammation of the appendix due to infection. In here, the appendicitis, it means the inflammation of the appendix due to infection, and there is some causes. The causes related to infection: first, infection into the lumen of appendix. This is first cause is the infection and into the lumen appendix. Second is obstruction into the colon. Others, blockage into the lumen. These are the causes. There are three causes: infection, obstruction, and blockage. Now we will see the pathophysiology of the pathophysiology. It means how the disease is occurrence. First, due to infection into the appendix or inflammation into the appendix, that called appendicitis. And how it will occur? The first is due to infection. Blockage or obstruction into the lumen. Second, in there, when at that time they increase the pressure into the lumen site, then the infection or inflammation see the pathophysiology is there due to infection obstruction of the lumen, increase the pressure into the lumen site, then obstruct the blood supply, then infection may occur. In here, first infection of after infection, the obstruction into the lumen site, and then the increase the pressure of the lumen site, and after the blood vessels or the proper not proper supply of the blood in the particular area, and then infection may occur. Now the see what are the symptoms are showing in that appendicitis. What are the symptoms are showing in here? First is infection due to infection, fever, then anorexia, next other symptom, next is nausea, vomiting, next is pain into the right lower quadrant of abdomen. These are the symptoms regarding. First is infection. Due to infection, fever may occur. After the anorexia, nausea and vomiting, then pain into the right lower quadrant of the abdomen, and some other like restlessness and other. These are the symptoms of the appendicitis: infection, fever, anorexia, then nausea and vomiting, pain in right lower abdomen, and next is restlessness and sleeping disturbance and insomnia like. Okay, now the diagnosis. What are the diagnoses we can do in here? The common diagnosis is history collection and physical examination. Common diagnosis is history collection, then physical examination. Second is X-ray, CT, next USG, next CBC, next leukocyte. In here leukocyte count we will check. These are the diagnosis of the appendicitis. First, history collection. History collection it means how many times or how much in last time that the appendicitis is having, and the physical examination in what are the problems are feeling in the patient, and next is X-ray. We can we can do in there, and CT scan, USG, and USG it means ultrasound, and CBC means complete blood count. In here we can check the majorly the leukocyte count. And what are the now the management of the? There is management is two types of management. First is medical management. Medical management in here we can give an all analgesics for reducing the pain. In here, analgesic like tramadol and some other drugs. And second is antibiotic to reduce the infection को control, for the infection control. In here we can give the ciprofloxacin, like ciprofloxacin, and some other drugs we can give. And second is surgical management. In here the most popular is appendectomy. It means removal of the appendix. So these are the management of the appendicitis. So today what are the discussed in the appendicitis? The definition is inflammation of the appendix, and the causes, there are so many causes like infection, obstruction, or emergency surgeries. And here the next is pathophysiology. The pathophysiology is due to infection. There is infection when the obstruction into the lumen and increase the pressure into the lumen side, then they disturb the blood supply, and the last is infection and inflammation may occur. And after the some symptoms, there are lots of symptoms, like first is due to infection the fever will be increased, and some other like anorexia, nausea and vomiting, uncomfortable sleeping, or it means we can say like insomnia. And now the last is last means diagnosis is we can there in history collection and physical examination, and in some other screening tests like CT scan, X-ray and USG. And one more and last is how to manage the appendicitis. It means there are two types of management. First is medical management and second is surgical management. In here medical management, we can give the analgesics for reduce the pain like tramadol and diclofenac, some other drugs, and antibiotics we can give in here for the reducing the infection like ciprofloxacin, ofloxacin. There are so many drugs for reducing the infection we can give as a prescribed order. And the last and one more the management is surgical management. The surgical management in their appendectomy. The appendectomy means the to removal of the appendix. This is the last. And if in here for reducing pain, we can give the we can give the non pharmacological treatment like for reducing pain like positioning changes and ice packs we can give, and for reduce it may help to the reduce the pain or give the comfort position to the patient.